Hi, it's Kelly and welcome back to room 9 3/4. Today we're going to be talking about chest tubes. So we're going to be talking about chest tube setup, charting on chest tubes, troubleshooting chest tubes, all that good stuff. So we are pretty lucky here at U of L in our resuscitation bay in the emergency department. We do have what we call the chest tube cart, and basically it's a one-stop shop for all your supplies you'll need to give the physician at bedside to complete the chest tube procedure. So basically you'll go through all the drawers, you'll grab one of everything you need, and we'll kind of talk about each of those here in a second, and you will take all that to bedside for this procedure. So let's get into it. We'll start off with cleaning the area. So there's kind of two ways they can do this. For emergent chest tubes, they'll do like splash betadine prep. And then sometimes for non-emergent chest tubes, they prefer ChloraPrep. So the ChloraPrep is not in the chest tube cart. That is in the tube-in system. Again, just depending on if they want emergent, non-emergent chest tube placement. So what else is in the chest tube cart here is we have our 4x4s. You'll want 2 packs of those, one for cleaning and one for dressing the area afterwards. Also, in terms of dressing, you'll want your Vaseline gauze as well as your suture pack. Excuse me. Other things you'll need for dressing, we have our large Tegaderms here, and then as well as our silk tape for the end there. Another thing that we keep in there, we do keep both long and short suction tubing for just depending on what you'll need and how much the patient needs to move. But we do have long and short suction tubing in the chest tube cart. And we also have these connectors. So these 3-way connectors here are for patients with bilateral chest tubes. So we keep 2 suction canisters in each room. Especially if you have a patient that's intubated or something else, you'll know you'll need another suction canister for their respiratory area. So this allows us to use 1 suction canister for 2 chest tubes. So you'll hook 1 chest tube here, 1 chest tube here, and then this will be to your wall section. And then again, this allows you to use only 1 suction canister for both chest tubes. So, other things that you will need that are in the chest tube cart. This is our thoracostomy tray or pack. It will have everything the physician needs to insert the chest tube. So your scalpels, your clamps, your scissors, all of that good stuff will be in your thoracostomy tray here. There are some sharps in there, so just be careful. Make sure the physicians put all their sharps in the sharp containers. These are one-time, single-time use. Then you will have your Shore collection chamber here. We will go over an open one, but it looks like this here. And then your actual chest tube. So these sterile for obvious reasons, but they will come in packages like this. They will open them up. They'll look like this. So big thing you're looking for here, upside down here. Big thing you're looking for here is this. So this is the size of your chest tube. So in our chest tube cart, we keep 28, 32, and 36 French chest tubes. If you are to need like a pigtail chest tube or something like that, we call Central Supply here. They'll bring it up pretty quick to us. But this is an open 28 French chest tube. So pretty large tube that we're going to put into someone's chest. So you also want to advocate for this pain medicine, some sort of sedation medicine. We do give a lot of our people like ketamine here when they do get chest tubes. It is a pretty painful procedure. So you do want to advocate that for your patient. Okay, so this is the big thing that we have to set up. Usually our emergency department techs, but also our nurses both will set this up at bedside before the procedure has begun. So kind of some stuff about the Shore collection chamber. These do not come preset, so we do have to set these per provider order. Usually it is -20, so what you'll do is you'll just click this arrow up here until you get to -20, or whatever they would like for their suction control. There is a syringe on the back. This will be full of water. Now, you can put this syringe in here. You can kind of twist it in there and put the water in there, or you can put it in through the top through the suction port. Either way you would like. And it will put the water again in this chamber down here. So once you have put your water in, you've set your suction control, and you will plug your suction tubing from the wall to this port here. And then this, one of the features is it has this little suction control kind of navigator here. And what that's going to do is when you have adequate suction to your chest tube, this is going to turn orange. So it might not be a bright orange, but it is going to turn kind of a shade of orange. And that lets you know, hey, I have adequate suction to my chest drainage collection chamber here. Now, this indicator here is a negative pressure indicator. And so what that's going to mark is when you put the chest tube into this negative pressure cavity into the lung, this is going to turn orange. And that's going to tell you, hey, your chest tube is in negative pressure. So it's probably more than likely in the right spot. And so when you pull out this collection chamber from the kit, this will come all kind of wrapped up really nicely. So what you're going to do is you're going to want to hand this, we'll kind of uncap this and hand this to the provider. You don't want to touch any of this because it's going to connect to your chest tube drainage if possible. So when you set these down too, you want to kind of kick out the kickstand here. Just ensures, you know, for better positioning so that it doesn't fall over. You really don't want these things to fall over because you don't want to get blood throughout the collection chamber, especially makes a little trouble charting and things like that. So if it ever does get knocked over for any reason, you do want to change chest tube collection chambers. So we'll hand them this. This will connect to this part of your chest tube. Again, this is when you'll see that negative pressure indicator on. When you plug this in, it'll let you know this part is in the negative pressure area. So a few other things that we see on the Shore collection chamber. So this is a little clip that you can clip to like bed rails, help with any loops, anything like that. Again, you don't want any big loops or anything in your chest tube for drainage purposes. So that is a really cool feature. And then this is a clamp. So we only clamp chest tubes on provider orders, but there is a clamp on here. You'll just slide it just like kind of a IV tubing, a little harder because it's a little larger, but you'll just slide that in there to clamp it. And then the hangers to transport are on the sides here instead of they used to be on the top of the handle. So that's just another good feature of the Shore collection chamber. You can put your patient name and then start date and time. So for charting on your chest tubes, you want to chart both on your chest tube and in the electronic medical record, just places that we can find it to ensure accuracy of our chest tube drainage. So on here, every hour you'll mark where it's at, and then, you know, date and time it, initial it, all that good stuff so that we can adequately and accurately keep up with the amount of drainage that's coming out of the chest tube. That is super important because those numbers can determine whether your patient needs to go to the OR for further chest exploration or go elsewhere within the hospital, ICU, PCU, things like that. So we always want to make sure that when we're hooked to suction, our indicators are both orange, the negative pressure indicator when we're hooked up in the chest, and again, the suction control indicator when we are hooked up to suction. The only time that should be off is during transport. We do not hook patients to suction, but we do want to make sure whenever they get to their next stop that they do have suction set up for that chest tube. Again, we are super lucky to have the chest tube cart. If you ever have any questions, please reach out to an experienced nurse or tech. They'll be more than happy to answer your questions. And that is chest tubes. See you next time on Room 9 3/4.